where he also has responsibility for coverage of Africa and the Middle East. A science and policy journalist with 25 years experience, he taught science and innovation policy communication at Imperial College London between 2007 and 2017. He has made several documentary programs for BBC Radio, including Surviving McCarthy in 2019 and Science, Right or Left in 2013, that explored why center-right audiences are losing trust in the scientific consensus. In 2009, he wrote and presented a three-part series called Science and Islam to accompany his book, Science and Islam, A History. His most recent book, The Great Invention, on the story of GDP and the search for alternative economic indicators in 2016. Ehsan studied applied physics at Portsmouth Polytechnic, UK, and science communication at Birkbeck College, University of London, and he is based in London. Mr. Masood's keynote address will be followed by a Q&A session at the end, so please write your questions in the chat box and we will address them at the end of the session. Mr. Masood, the floor is yours.
Thanks very much. Thank you, Salma. Respected colleagues at the American University in Cairo, at the School of Global Affairs and Public Policy, and the Kamal Adden Center for Journalism, dear friends, it's a real privilege. It's a real privilege to be among you again, though very much in circumstances that are so different to last year's forum. In fact, I did come to Cairo, some of you may remember, to attend last year's event, and that also happened to be my last international journey. And as I took the flight back to London, which was on March the 8th in 2020, I now know, as we all do, that the coronavirus SARS-CoV-2 had in fact been circulating for several months at that point. So if we fast forward 15 months later, we're now at the end of June and close to or approaching 4 million deaths. In January, it was just short of 2 million. And that's a doubling of mortality in just around 6 months. It is, among many, many things, it's just one of the most frightening numbers that I've had to report or see, well, forever really. And as of now, there are very few signs that this pandemic is going to come to an early end. Most of the indications that I've read, and that many of you have read too, I'm sure, suggest that the poorest and the most vulnerable people in the lowest and the middle income countries will probably have to wait another 2 years, sometime in 2023, before everyone gets their vaccines. So I'm going to talk to you about what this pandemic means for two things: for science journalism, for the craft, the profession that we're all in, and for public policy. A bit of a spoiler alert: some things we already know, others we don't. And I'm going to propose some arguments. But as we're still in the midst of the pandemic, some of what I say, and I honestly mean this, so much of what I could say may turn out to be wrong. And one very big caveat: I'm a journalist in the news team at Nature, but today I'm speaking strictly in a personal capacity. Okay, so first let's talk a little bit about science journalism. What does the pandemic mean for the craft of science journalism? What does the 2020 coronavirus pandemic mean for our profession? I think this pandemic could be science journalism's Watergate moment. Now, what do I mean by that? Well, just as a hotel break-in 50 years ago changed American history, led to the resignation of the American president, and changed global journalism by mainstreaming investigative journalism through the reporting of the Washington Post, I do believe that this pandemic has the potential, to show the world why science journalism is so needed. And I hope it means, for example, that publishers employ many more of us, many more science journalists as writers, as editors in data and multimedia roles, as translators, as production staff, as fact checkers, and so many other jobs that I haven't listed. And I hope that universities around the world, like yours and so many others, can provide more qualification courses, more training, more opportunities for young people, all those people who've been watching and listening and participating and maybe campaigning and reading about this pandemic, allowing many more of those young people to become science journalists and to enter this profession. And I hope, last but not least, that employers will provide more continuing professional development for people like me, those of a certain age who came into journalism when Microsoft Word was cutting edge technology. And so there's a real opportunity here, I think. Science journalists have been, I would say, essential public servants in this pandemic. And we've been essential in at least a couple of ways. Firstly, we've played an explanatory role. And by this, I mean that we've helped translate a volley, an absolute volley, of complex and often contradictory information for our audiences. And we've had to do this very, very quickly. Questions like, what is this new virus and disease? What is its structure? What are its symptoms? How does it spread? How do we stop it from spreading? How do we treat it? How do we not treat it? And how do we protect ourselves from it? Every day, in every country, and I hope every language, science journalists are on the front line, explaining or helping to explain, contextualize, interpret, comment on these and many more questions. That's the sort of science communication part in a way. Then there's the journalism part. What do journalists do? Well, we try and hold our leaders to account where we can. Of course, I would argue that this is more difficult than the explanatory part. And post-pandemic, who knows where it may go. We know, of course, all of us know that our leaders and policymakers have a difficult, perhaps an impossible job. Keeping people safe is the first responsibility of governments, and it's hard enough in normal times, let alone in a pandemic. But as science journalists, it isn't our job to cheer on our great leaders every time they make some claim about the pandemic, about testing or vaccines or personal protective equipment. And of course, at the same time, as Dr. Tedros of the World Health Organization says repeatedly, he talks about an infodemic, a pandemic of misinformation and disinformation, which is coming from many, many quarters. Information needs to be verified as much as possible. And at the same time, we want to be able to trust our leaders. So that does present us with a bit of a paradox. And I would suggest that with trust must come verification. And so in a way, our motto as science journalists has to be trust, but verify. Trust, but verify. So how else do I think the pandemic will affect science journalism? Well, I want to take you back to January 2020. This was when many of us, myself included, started to read the reports of the new virus, unknown at the time, originating in China, then being detected in Japan, in South Korea, and Taiwan. Those first reported cases, I remember, initially 100, then 200, then 300. First reported deaths in the media, a handful. Now, I remember this time for a number of reasons, but one of them was because around, I think it was the third week of January, there was a modeling team at Imperial College, epidemiologists, who published a report on their university's website. And this report certainly helped to change Britain's pandemic strategy, if not of other countries. What did this report show? Well, the modelers showed, using travel data from Wuhan, that cases were many multiples of 300 and likely in the thousands. Now, I remember this because, like then, like many people, I knew very little about public health. My primary training is in the physical sciences. And yes, I've reported for more than 20 years on science policy, as Salma, you mentioned very kindly. But I am not, and I haven't been much of a specialist in public health. So I remember when I saw that early model projecting 6, 7, 8 times an increase in cases of a virus that no one's heard of. And I was thinking, like, how do they know this? It's just a report on their website. It's not in a journal. Where's the peer review? Where's the quality control? all my usual questions that I would ask started to filter through. Now, of course, in the context of 4 million deaths, it's almost too trivial. It feels too trivial. But it's important because until that point, I hadn't understood, and I think many of us in this community hadn't understood the power of preprints, essentially preprints. When researchers publish their findings directly onto the internet, either on their university websites or on specially curated sites that are hosted and managed by their communities, I don't think I'd understood that quite what the potential of this form of publishing would be. I'd understood preprints to mean it's a space where you show an expert community your research, you improve your paper before it gets submitted to a journal, and then it goes for wider circulation. I think the pandemic is going to have and is already having a huge impact on how we communicate and disseminate science publishing. The whole world, not only science journalists, but anyone who's literally on social media has seen preprints in action, and they have been completely central to fast and speedy communication, often by researchers themselves, some of whom have been very good at summarizing their arguments on social media. Quite where it goes next is harder to say, and maybe something we could discuss or touch on in the Q&A. But one thing I hope, and it is a hope, is that this doesn't stop scientists from doing the other essential things that are part of doing science, and particularly collaborating and sharing, which so many have been doing during the course of this pandemic, and of course, which, as we know, in so many fields, including all the fields related to the pandemic, are so essential to the practice and the conduct of science. Okay, I'm going to scoot on to the second part, which is about pandemic and public policy. One of the defining features of this pandemic is the extent to which countries have been acting alone. And this is, in a sense, it's the counterpart or the contrast to how many researchers have been acting. And quite honestly, I feel ashamed to say this, but this feels like it's been a pandemic of selfishness, particularly from the governments of the places where I'm sitting. And I don't know, and I'm somewhat afraid of what it might mean for the longer term. We would think that having some of the most authoritative science advice, all of the countries in the United Nations or the G20 or the G77, they would know that they need to work together to coordinate their actions. But of course, we know this hasn't happened. And just to illustrate the contrast, I want to take you back to the financial crisis of 2008, when it was very clear that all of the world's major banks would need recapitalizing. Very quickly, world leaders and ministers of finance quickly got together and they coordinated their actions, and they helped to stave off, at least temporarily, a much bigger crisis. We've not seen that kind of behavior in the pandemic. Yes, there's been some high-level cooperation, but the thing that surprised me is that every minister and head of government and head of state has access essentially to the science that we have access to. Everything is visible. And yet there's little consensus when there needs to be, or there could be, on simple things. What are the rules for locking down? When do you open and close borders? What are appropriate social distancing policies? What are the standards for personal protective equipment? I could go on. Countries are making up their own rules. And that's before we get to the horror story that is vaccination. A year ago, we know that the World Health Organization created a COVAX scheme, and it was originally intended as a way for companies and governments to share their vaccines so that 20% of the most vulnerable populations in every country, not only in the low and middle income countries, but in every country, would get their vaccination first before moving on to less vulnerable groups. It was very much a scheme where it cascaded, but everyone worked in concert. Well, did that happen? Of course, we know it didn't. 11 billion doses are needed to vaccinate more than 2/3 of the world's population. And we are getting there. We'll soon be at 3 billion. But something like 80% of those vaccines have gone to high-income countries. And they are very evidently looking out for themselves, because many of them have over-ordered massively and they have 4 or 5 times of the supply that they need. Ending this pandemic really needs a different way of thinking, and it needs countries to consider that the national interests are completely tied to the world's interests. And as we so often hear, especially from the World Health Organization, no one is safe until everyone is safe. There is one silver lining, though, when it comes to public policy. First, of course, the bad news. During the pandemic, we learned that African countries rely on imports for 99% of their vaccines. When I saw this, I was staggered. I was completely staggered. Only 1% of the vaccines on this continent are being manufactured at home. And it's a key reason why the lowest and particularly the lowest income countries are at the back of the queue, because they just simply don't have the research and development or the purchasing power. But there is some good news. The African Union, the African Centers for Disease, the Africa CDC, African Centers for Disease Collaboration, Disease Control and Collaboration, I never remember it right. They have a plan. They have a plan to bring more vaccine manufacturing home, to bring more research and development home, and eventually, within a decade, maybe it'll take a little bit longer, to have at least half of manufacturing on the continent. And that's extraordinary, because that, it's extraordinary in many ways, but it needed a pandemic to make this kind of change, and it will be a really, really important change. Last point, and then I will stop. As some of you know, and some of you mentioned it kindly, I also study the history of science, and I've been rereading some of the literature around science communication and public policy in the 12th, 13th, and 14th centuries in the Middle East. And I was doing this because when I wrote my book on the history of science and the Islamic empires, there is a lot of literature on plague. But at the time, I didn't really pay a lot of attention to it. I did read it, but I didn't pay a lot of attention to it. And I've just gone back, looking at it again with very much with the context of the present. And of course, many of you will know, all of you, I suspect, will know, there's been a lot of scholarly discussion around the hadith from Sahih Bukhari, which was compiled around the 9th century. The very famous quote, which is to say, don't enter a place if you hear a plague occurring, and of course, stay put if you happen to be in a plague-infested area. Now, in my own book, I sort of contextualize this through a debate involving a number of different scholars, but mostly scholars of hadith with physicians. And there's one particular central person in this, who's Ibn Qayyim al-Jawziyah, a 13th century hadith scholar and physician, who has a book called The Medicine of the Prophet, which has survived in its original Arabic and is now also available in English. It's essentially a compilation of medical advice that's taken from the hadith literature, and mostly from the Sahih Sitta, the 6 canonical sources that scholars regard as being reliable. So when I read this more than 15 years ago, when I wrote the book, of course it comes across as very anti-science. And Ibn Qayyim it feels like it's a long polemic, a long argument against the medical scientists of the day, especially people like Ibn Sina, who base their prescriptions more on experimentation and on patient testimonies. And there's one particular passage that I think I quoted in my book, which is where Ibn Qayyim says, the physicians have nothing to repel these illnesses, anything more than they have to explain them. And I still remember thinking at the time, like, why is he saying this? Because what he's basically saying is that if you have a plague, it means you should stay put, perhaps risk your life. And then why is he saying that doctors and physicians don't really know better? He's a physician himself. He should know better. Maybe he needs to be a bit more responsible. And in my book, I'm kind of a little bit rude about him, to be honest. And now I think with the great wisdom, the benefit that's called hindsight, I now wish I hadn't been there. Because of course, what Ibn Qayyim al-Jawziyah is describing is the two things that every person now living on planet Earth probably knows well. He's talking about lockdowns and quarantine. And if I were to reinterpret that passage for now, it would probably mean don't go to a place where there's a pandemic. And if you find yourself in a pandemic, for God's sake, please self-isolate. So just to sort of end, we have all this phenomenal and amazing science and technology at our disposal. And yet, what a paradox, what a complete paradox that in one respect, we are still having to rely the hard way, we've learned the hard way, on an older but very much tried and tested method to protect ourselves. Thank you so much. Thank you for the invitation. Thank you to Sarah and to Heba and to Salma, and I'd be happy to have a discussion. Thank you.
Thank you, Mr. Masood. I think I speak on behalf of everyone when I say this has been very rich and enlightening to all of us. Any questions from the floor? I've had a couple on my phone that I'd like to present to you.
Yes.
So, Mr. Masood, we're aware that many countries have tried to reduce their COVID-19 infection rate. They're now trying to encourage people to get vaccinated using different measures and policies and incentives and all that. And the reasons for the differences in policies, as you said, are complex. Not everyone was following the same guidebook because there was no guidebook per se. And how efficient the public's response to that has been in part depending on the speed and the scale of government intervention, and how the public has received and acted on the information that has been intertwined with a lot of fake news and rumors and pseudoscience and all that. So while we're aware that there's no one-size-fits-all communication strategy to deliver information during a prolonged crisis like the one we're currently in, what would you say would be some of the main characteristics of an effective governmental crisis communication, since we're speaking about science communication, particularly today?
That's a really good question, Tom. It's a really good question, and it's a difficult question because I think it would probably vary according to national context. You know, the government kind of crisis communication system is often quite different, even amongst groups of countries that are at a similar income level. If you take the United States and the United Kingdom, they have quite different ways in which they are communicating. In the United States, for example, journalists are physically present, although socially distant, when policymakers, including science leaders, are presenting their latest data or latest policies. And that allows for a very two-way interaction. Whereas in the United Kingdom, they are doing all of this on Zoom or other online platforms, which on the one hand potentially allows potentially more journalists in the room, but it doesn't allow for a more iterative interaction, and it's harder to ask more deeper or more searching questions of the scientists employed by the government or by the policymakers themselves. So just in that one level, there is a distinction, and that's before we get to countries like, for example, Tanzania under the now departed President Magufuli, who died, who did not allow the media and possibly also researchers to conduct and to carry out investigations on COVID-19 or SARS-CoV-2, and so I think there's a kind of real range. I think it's going to be hard to sort of to think of sort of one prescription, but I think as I was saying, there's no doubt that what this has done is it's put journalism, science communication completely front and center, and tens of millions, hundreds of millions, in front of hundreds of millions of people. We were just the sort of the bottom of the barrel when it came to the media landscape, and that has changed.
Yes, I think this is absolutely correct, and this is why our event today, I think, is more timely than ever because it discusses the very challenges that you were presenting today. Dr. Amin wanted to ask a question. Dr. Hassan Amin, the floor is yours.
Thank you, Shannon. My questions has to do with policies, not for the states, but also for Ofcom, for example, in the UK. Was there any particular policy that you would like to shed light on that Ofcom introduced as a framework and a directive in the midst of coronavirus? And we hear that the UK is going to close down certain areas with regard to Delta and Delta Plus, fearing that is going to affect a big segment of the population. We have the same concern over here, but we don't see really a kind of a media policy that is dedicated particularly to COVID-19. I thought at the beginning that we will find, some media channels, whether, a kind of a new television network is completely dedicated so that, people will have the information from it. I'm talking about a national level, because a lot of people, especially people in the developing world, they are depending on their national networks, even transnational networks. When it comes to them in Arabic, it's not as effective as the local networks that addressing the people, addressing the problems in a particular area. This is one part of the question, actually. The second part has to do with, with regard to using some of the quotes that I haven't seen it in the Arab world, because in the Arab world, the media systems. I'm not sure why. Maybe this is a good point for research. But what I'm saying is, for example, when we talk about media bias, or we talk about deep fake news or fake news, there is Imam Shafi'i and his statement that رأيي الصواب يحتمل الخطأ. My opinion is right, but there is a probability that it could be wrong. And رأي الآخرين and the opinion of others is wrong, could be right. And the verses of the ayah, which is يا أيها الناس إذا جاءكم فاسق بنبأ فتبينوا عسى أن تصيبوا قوم بجهالة تصبحوا على ما فعلتم نادمين. And over here, the fact checking is a process that as a direct message, but this is not being used in any of the PSRs, for example, to make sure that the people who are conservatives and sometimes pious to take these messages and act accordingly. I'll stop here. Thank you.
More difficult questions. I'll briefly. I'm probably not the best person to honestly comment on the second one, but the one thing I will say is that, and I came across this dilemma myself when I was sort of just doing my reading and interviewing people like yourself and experts, which is that, and I suppose it also this relates to how we are taught our Islamic studies, those of us who come from Muslim families, or in my case as a child, and everything is very decontextualized. And there's a small book that many of you will know, which is Imam Nawawi's 40 Hadith, which is very it's been translated into lots of languages and it's available everywhere. And it is, on the one hand, most of the quotations come from reliable and canonical sources, but on the other hand, the actual quotes themselves are totally out of their context. And I remember many years ago when I first read it, and subsequently since, thinking that it's a kind of great disservice just to expect children and young people just to memorize this information without understanding the broader story. What was it intended for? Where did it come from? Who was the intended audience? And your precise question, how do we really know about its reliability? There's a story that I remember from a text from astronomy. There's a book, if anyone's interested in the history of astronomy, and it's called The Observatory in Islam, and it's by a Turkish historian called Aydin Saili. And Saili writes in this that in the early days of astronomy, there were some really fascinating debates between the scholars of Hadith and the astronomers. And the scholars of Hadith said to the astronomers, "You're coming up with all this new science, but how do we know it's true?" And the astronomers said to the Hadith scholars, like, "Well, why are you asking this?" And the Hadith scholars said, "Well, we have a system of fact checking, and it's called the Isnad system. And it's not perfect, but it's what we've developed. What is your system? Essentially, how are you doing your peer review?" And it made me smile, and I thought, that's interesting. We don't hear that. So I think on your first question, I don't, to be honest, I haven't looked in detail. Ofcom is the British media regulator, so I couldn't say in detail what they have advised. It's a good question on pandemic communication. The one thing that I will say is that, so at the moment, we are going through in the United Kingdom, we're going through a situation where there is a lot more tension between the present government and the media community. There is always, it's a fact of life that there are always going to be tensions between whichever government there is of the day and with the media community. We all have our different jobs to do, and the tension is a part of that. But right now, we're probably experiencing more tension than we have before. And we have a government that is more controlling in what it wants the media to say. Now, it might well argue that that control is needed, or that desire for control is needed, because we're in a pandemic and they want information to be authentic, authoritative, or reliable. But in the process, they have done certain things which are, I would say, not particularly conducive to good government media relations. For example, for quite some time, they prohibited certain channels that they didn't like from being given access to ministers for interview. That has changed, but it was the case for some time. And similarly, they want to, their preferred candidates to head the media regulator was for a long time a very unsuitable person. And so we're having some problems right now in that situation.
Dr. Hiba Shahid has a question.
Thank you, Ehsan, for always such an enlightenment session and presentation. Well, I have a comment and I have a question. So my comment is referring to the pandemic as a Watergate moment. Well, isn't it? For everything involved as a stakeholder in the media industries and everyone who took part in the pandemic, which is basically everyone, because it took every feature of life and every aspect of life. So referring back to your media background in the Middle East, in terms of the policy making, what would you say, again, in relation to the media-government relationship? What is it that's missing? Is there a variable missing that's not enabling us to make better policies, or is it a certain agenda? We could refer back to the idea of control over what type of dissemination of messages we want out. I wanted to hear your opinion on, are we missing certain variables in terms of policy making? Are we missing stakeholders? Are we missing a force of some sorts? I'm not trying to say the words that you know that I want to say. I was just trying to hear more of you of this type of bipolar relationship, and the people aren't really part of it. What would be the variables missing to enable, or maybe just advance better policies?
I think the one thing that I wish we had more of, Hiba, is, and it's not always easy, but I think it's possible. I wish I heard. I wish we could hear the organized voice of science more, because, you know, just to give you back to a United Kingdom example. So in the early months of the pandemic, we knew that scientists were advising the government through various committees. And as we all know, the best science is done when the evidence is published, when discussions are public, when all of us have an opportunity to ask questions and to interrogate and interview. And for quite some months in the beginning of the pandemic, this advice was not published. The membership of the committees was not made public. And what it did do is, it was obviously very frustrating for everybody, not only just science journalists, but it was frustrating for the public, for other people in public life and so on. And it led to the creation of an independent group of scientists who then, from all the different disciplines that are very active in the pandemic, virology, epidemiology, different aspects of public health, public policy, and so on. And they just organized themselves. And of course, the technology allows that organization to happen. And they call themselves, so the official government advisory body is called SAGE, or Scientific Advice in Emergencies. And they call themselves Independent SAGE. And they would put their meetings on YouTube. They would allow anyone to attend. They would make themselves available for interviews. And in doing so, that was one of the reasons, wasn't the only reason, but it was one of the reasons why the government then quite quickly moved its official science advisory body into a more public setting. And it allowed journalists to interact, and it allowed members to talk to journalists. It published all the minutes of their meetings, published the evidence on which the policies were being implemented, because of course, as is often the case, policymakers don't always, as we know well, they don't always follow evidence, and they don't always make decisions based on evidence, sometimes for good reasons, sometimes for not good reasons. But at least they were clear. And it also created another thing, which was that it allowed the scientists who were advising the government to be a little bit freer to say if they disagreed with a particular policy. Because in those first few months, there was a sort of very tight relationship where the minister and the scientists and everybody was on this podium, and they were all parroting each other's words. And there needed to be a break with that. And I think when this independent body of scientists emerged, and they were very respected people, and they started, I think that gave the government scientist advisors the sort of courage and the ability to speak out more. So I think broadly, if I was to think of this on a more global scale, it would be fantastic for all of us if we had access to a consensus community of researchers who are thinking and writing and researching, people that we come to who are perhaps outside of the government system, but connected to it at the same time. I think that would be really, I would say that would be really, really valuable. And it could be through the academies. I mean, Egypt has several science academies. and you know, other countries in the Arab world. Actually, I say that, but there are some countries in the Arabic-speaking world who don't have science academies, and where it is more difficult to organize. But that, I would say, is probably an essential.
This is going to be our last question because we're running out of time. It's from Morocco, and it's, let me translate. Hussein Al-Alali from Morocco is asking how to, I'm assuming how governments should act in the absence of correct information during the coronavirus pandemic. For example, if a group of information that is not accurate has been disseminated and circulated, and that led to the misunderstanding of the pandemic, and so the journalist or the media person could not provide the correct information at the time. So I think he's talking about the fact that due to the race and time that experts and scientists are in all the time, especially at the beginning of the pandemic, a lot of information was coming out that was not accurate or verified, and that was disseminated and carried on by the media and presented to the public, leading to exacerbating the problem. I hope I got the translation correct.
It's really good. It's a good question, Salma. I think one way, this is I don't have like a great insight into this, but I think one way is, in fact, if those of us who are in the working community of science journalists and science communicators, I think we need to speak up when this happens. I don't think we have seen ourselves quite in that role up until now. I think we've been sort of happy to just, you know, kind of stay sort of on the sidelines and publish our work. But I think this involves a slightly more active engagement. And so when we do see particularly disinformation, but to some extent misinformation too, but if we see disinformation, I think we have to fight it. I mean, I'm kind of reluctantly coming to that conclusion. You know, if I was a campaigner, I'd become a campaigning organization, but I'm not. I'm a journalist. I've not seen my role in that way, like so many of you. But I wonder whether this means that we just, because lives are at stake and, you know, the health of people is at stake, if we know better and if we have evidence, then somehow we have to combat it. Quite how we combat it, I don't think I could say like straight off, but I wonder again if it requires a level of organization, which we haven't done up to this point. Because I've noticed on social media that sometimes when I've seen wrong information or deliberate or disinformation, I've seen colleagues of mine who are braver than I am, who have more courage, sort of step in and actually say, no, this is actually not representative of the consensus. The evidence doesn't support this. And it's led to some unpleasantness sometimes, and it's difficult, but I wonder if more of us need to be doing that.
Absolutely. I don't think we have any more questions from the floor. We'll need to wrap up this very interesting session. Again, thank you so much, Mr. Masood, for this very rich presentation. I think I speak on behalf of everyone. I say this was really insightful. We hope you stick around with us until the end of the forum. Thank you again. If any more questions are received, I'll email them to you if your time allows to take them.
Yeah, no, please, I'll be happy. I need to hop off, but I'm going to join again in the afternoon. So I'll see you back in the afternoon. All right. Okay, thank you so much, Dharma. Thank you, Heba. Thank you, Ben.